And let's turn to health matters. Do you know that at least 2 people in every room you are in has malaria, HIV, or tuberculosis? Now, this is according to Global Report for Health. A group of health professionals say community intervention, access to quality care, and improved medication will further reduce the wave of these diseases, particularly in West Africa. Inioluwa has more details.
The wave of malaria, HIV, and tuberculosis in West Africa is why representatives from 5 countries, Nigeria, Mali, Burkina Faso, Cameroon, and the Gambia, are gathering to discuss and measure the success taken so far to combat it. According to a health report, West Africa has the highest rate of malaria, HIV, and tuberculosis in the world. One of the issues brought forward is how to improve access to health care and ensure proper data is collected on the number of cases and treatment.
We need to generate more data to be sure in terms of statistics. But generally speaking, the numbers are going down, even tuberculosis, because one of the things they do actually in NIMA is a diagnostic center for tuberculosis, like a reference center, where they bring specimens from selected TB cases, where they analyze them, identify the bug, and they also actually test them out for whether or not they are susceptible.
There has been a stall, there has been a leveling in the way that the disease has been decreasing, in the rate at which it has been decreasing. And some of this leveling off has been for 2 reasons. One has been insecticide resistance. The mosquitoes are not dying when we use the insecticides. The nets that are being given to people are not using them properly. Some people are using them for fishing instead of using them to protect them against mosquitoes. And people are not accessing health care to get treatment time, get diagnosed properly, and get treated properly. And so there are also issues with drug resistance. So cheap drugs like chloroquine that used to be available and accessible to everybody are no longer available. We have to use combination therapies. And all of these have contributed to the issues with the parasite persisting in our communities.
The concern about fake drugs being sold has been a recurring challenge in Nigeria, for which the government should constantly monitor the hospitals and pharmacies.
The best way to deal with that actually is to stop them from coming in, because can you actually test out everywhere across the country? So we need to enforce regulations that are available to make sure that we don't allow fake drugs to come in country.
As these medical professionals look to completely eradicate these diseases, they say government, education, and health professionals show a wholesome health care for citizens. Inioluwa Popola, TVC News, Lagos.
Minister of State for Health and Social Welfare, Tunji Alausa, says the federal government is determined to make Nigeria the hub for medical and clinical research in West Africa. This, the minister said, will be done through striking a balance between advancing scientific knowledge and protecting the rights, safety, and well-being of research participants. And health correspondent Kemi Balogun reports.
Over the years, the lack of regulations to support and promote health research in the country have been evident. While the country has developed a regulation document for health research ethics, compliance to this document has largely been affected by the lack of legislation. This time around, this issue is going to change with the drive by the present administration to ensure optimal protection of Nigerians partaking in research studies. At this inauguration of the 3rd set of new members of the National Health Research Ethics Committee, the Minister of State for Health says the team will be expected to create a balance to uphold the higher standards of medical and health-related research.
We believe maintaining high ethical standard in our healthcare system, both in every sector of our healthcare system, front and center, from pharmaceutical research, device equipment, and the care we provide to our citizens. And that's why that's one of the major roles of the National Research Ethics Committee. They will be the ombudsman. They will police our healthcare system.
The newly inaugurated committee aims to enforce standards and protocols for conducting ethical preclinical and clinical trials in the country.
The National Health Research Committee will work independently
but in synergy with the recently inaugurated National Health Research Committee to serve as a catalyst for fostering a culture of ethical research within our scientific community. So, as already enumerated, to attain the level of research and impact that we need in the country, we need sound scientific basis for which the other committee has been inaugurated, and we need to be ethically sound as well.
This committee will play a part in creating new avenues for healthcare research by adhering to rigorous standards of human dignity, transparency, and integrity. This launch of the NHREC comes as part of the 4-point agenda of the Ministry of Health, as it hopes to regulate research and also ensure that it meets all the ethical criteria of clinical science. Kemi Balogun, TVC News, Abuja.